Hello, friends, and welcome to the March 31st edition of Weekly Witness, Texas Impact's weekly podcast designed to help mainstream Texans of faith understand the legislative process and help you engage with the Texas legislature. My name is Scott Atnip, your host and Texas Impact's Director of Public Witness, and this week we welcome Terri Burke, Executive Director of the Immunization Partnership, to talk about the importance of vaccinations and vaccine-related legislation in the Texas legislature. But before we get to the conversation with Terri, I wanted to take a quick moment to share some thoughts on the Texas legislature. Y'all, this week has been a combination of inspiring and exhausting. For those who have been part of our weekly legislative updates with the legislative engagement groups, or the weekly team meetings, or following along on social media or Texas Impact's Leg TV channel on YouTube, you'll know that advocates of faith have been doing incredible work at the Texas Capitol. They've been fighting for maternal health and sensible gun regulations while opposing anti-trans legislation, restrictions to voting rights or school vouchers, and so much more. But this week I found myself standing amongst a room full of advocates for LGBT equality as they heard so many mischaracterizations or lies told about them while being demonized from the podium. And y'all, it was hard to take. Harder still was to see and experience the tears as they spoke about the impact bills would have on their own lives. And yet those same young people in the overflow room would shout for joy when Texans of faith or Texas clergy had their back in testimony opposing harmful bills. They celebrated seminary students, setting up an all-day prayer vigil supporting them. Those moments brought great hope and a great reminder of how important our advocacy work is. Friends, we're going to have some good moments during this legislative session. We're going to be inspired and lifted up. But on the other side, we are inevitably going to lose some fights. But we have to keep showing up. Our communities in the Texas legislature need our faithful witness. Members of our communities need to know that you are standing with and for them. But successful advocacy work doesn't end at the Texas Capitol. We need to be paying attention and sharing the story of what's happening in the legislature with our friends, congregations, and communities so they can make informed decisions about whether this is the way they want their government to represent them. Thank you for paying attention. Thank you for your advocacy, and let us know if we can further resource your work. If you're missing out on some of the opportunities I named at the top, go to texasimpact.org and click on the Action Center to make sure that you're participating in all that Texas Impact has to offer. If you have questions, please feel free to reach out to me at scott@texasimpact.org. So with that, I hope you enjoyed this week's conversation with Terri Burke. Joining us for today's conversation is Terri Burke, Executive Director of the Immunization Partnership. Terri, thank you so much for joining us.
Thanks for having me, Scott. I'm looking forward to talking to you.
All right. Before we jump in, why don't you tell us a little bit about the Immunization Partnership?
Sure. We are a nearly 20-year-old organization. We've always worked to support vaccination, immunization. So I like to say we were around long before COVID.
Yeah, right.
We advocate for public policies that increase immunization rates in Texas. The partnership, our tagline is, we give a voice to Texans who want to prevent disease.
So let's talk about pre-COVID, because I remember growing up, my mom would take me to the doctor and the doctor would give us a list of shots that we would take, and we would take them without asking too many questions. Same with my kids. My wife's a nurse, but sometimes I would take the kids to the doctor and they would tell me what shots they needed, and without even thinking, those are the shots they would get. So I'm vaccinated. I assume you're vaccinated. This used to not be controversial. So is all of this anti-vax momentum because of COVID, or was it brewing before that and I just wasn't aware?
Yeah, so it's been brewing. There were a lot of things that happened along the way that fed the anti-vax movement. A couple of key things to mention: Robert F. Kennedy Jr., who is known as a fairly liberal environmentalist. He really lammed onto a study that was done, I think, in 2015 that said that the MMR vaccine, the measles, mumps, rubella vaccine, caused autism. And so a lot of people latched onto that, and including Robert F. Kennedy Jr., who, had a name and in a way to get folks' attention, and so it kind of took on a life of its own, and so people were begun to say, "I'm not going to let my kid have this vaccine because they'll get autism if they do," and it turned out the guy who did the study, Andrew Wakefield, Dr. Andrew Wakefield, turned out had to admit that there were only 12 people in his study.
Oh, wow.
Yeah. And let me correct myself. This study was done in 2012. So he had to admit that there were only 12 people in his study, so it's really not scientifically valid. He lost his medical license in the UK. Happily for all of us, he lives in Austin, which seems to be the place for these people. But that combination of his study, Robert F. Kennedy Jr. promoting it, even Oprah was promoting it. So it just took off. And so nobody heard that the study had been discredited. Nobody heard that Wakefield had lost his medical license. All they knew was that autism thing. So that was one thing. And then in 2015, Texas has long had, your child could go to public school unvaccinated with a medical exemption, have some underlying condition that makes it not a good thing. We also in 2003 added philosophical exemptions. You could fill out a form and say that you were philosophically opposed and your kid didn't have to be vaccinated. 2015, there was a measles outbreak actually here in Texas, and there was a measles outbreak in Disneyland, and sort of spread around California. And so the California General Assembly passed a law to roll back all of those philosophical non-medical exemptions, banned them, no more. Only way you could go to school unvaccinated is if you had a medical exemption. So some folks in Texas said, well, gee whiz, that's a really good idea. We ought to do that. And they got motivated to repeal those non-medical exemptions. And that in turn gave birth to this rabid, fringe, right-wing anti-vaccination movement in Texas. And so Andrew Wakefield's still in Austin. A guy named Del Bigtree started an organization called Informed Consent Action Network. He's based in Austin. Texans for Vaccine Choice is based in Keller. And now yesterday, there was a woman who identifies herself as Texans for Vaccine Freedom. And I'm not sure where she's headquartered, but.
Yeah, so you mentioned a couple of different legislative sessions. We are just past the halfway point in this current session of the Texas legislature. What proposals are we looking at in Austin now, and are we making any progress from 2021, or are we going backwards? Where are we?
Well, in there were 3 sessions in 2021, as I think.
Oh, I remember.
There was the regular and then just endless special sessions. So over the course of that, we ended up with 61 anti-vaccine bills introduced. Now, some of those were probably duplicates, but you get my point.
Right.
And none of them passed. Something to make us all quite proud of. But
right. Now
we've come back. There are, I believe there's 46 bills introduced. Some of them are beyond absurd. I looked up the real definition of fabulous the other day, and they really meet the definition of fabulous. So then the question becomes, well, which ones are the most dangerous? And what's a little bit frightening, although I have some hope after yesterday's Senate Health and Human Services Committee meeting, but Senator Lois Kolkhorst, who chairs that committee, introduced a full package of bills that I would call them omnibus bills because they've got everything but the kitchen sink in them. And one of them got a hearing yesterday. I was heartened that at one point she said, this is just the start of a conversation. And so maybe if she means it, then that's great. I want to have a conversation. But the bills essentially make it harder for Texans to access these vaccines that we're talking about, polio, measles, so on. They're couched around COVID, but when you read the bills, the long-term impact is really quite frightening. They threaten immunization policies like the routine requirements our children get to go to school. They say that, so for example, right now, during this pandemic, as long as there was an emergency order in place from the governor, children who were unvaccinated, even if they had the exemption, children who were unvaccinated could not attend school. This one of her omnibus bills includes in it repealing that restriction. So in the next pandemic, children who are unvaccinated are going to get to go to school and put all of our children at risk. Right. It strips her bill and several others strip the State Department of Health Services from the authority to make rules regarding childhood immunizations. Now only legislators will be able to do that under her bill. And I'm sorry, but every poll I've seen, Texans say they trust their doctors more than their politicians. But we're going to have 181 of them deciding which vaccinations we get. There is a federally funded system to track adverse reactions to vaccines. Doctors are required to report any adverse reaction to a vaccine that is one of the adverse reactions that is anticipate. You know how you get that thing that says, here's the possible side effects. If it's on that list and it happens, the doctor has to report it to this federal system. Well, they've decided that's not good enough, so we're going to spend taxpayer dollars to have our own reporting system here in Texas. Because they said this yesterday, we're so much smarter than the federal government. And the problem with that is not only that it's going to cost taxpayers money that we shouldn't spend, but the problem with it is, as one of my colleagues says, my kid gets a polio shot and has 8 yellow spots on her face afterwards. That gets reported. She's the only kid in Texas to have those yellow spots on her face. But there's 20 in Ohio and 30 in Idaho, and we're not going to know about it. And that's how you establish a trend. That's how you establish a sense of the threat. Yeah. So it's the cost is one thing, but the harm to public health is really serious. There's we're gonna limit what immunizations kids have to have. There's one bill that would remove several of those regular childhood vaccines from the recommended list or the required list. I was just amazed yesterday at what I heard. Yeah.
I like your argument, and I think that it's one I have, that we should trust doctors, not politicians, when it comes to this important information. But what are you most concerned about in terms of if vaccinations drop? Which diseases are you most worried about?
Well, measles would be the first. Measles is really a frightening disease that people don't understand how frightening it is. I mean, it can cause death. Deafness, brain damage. and that's the one that people seem to always attack is the measles vaccine.
Right.
I don't see any evidence, for example, I mean, we saw it in New York, but I don't see any evidence that people are holding their kids back from a polio vaccination, for example. But the measles are what, I mean, I pulled up some stats, and in 2019, 95% of Texas kindergartners were vaccinated for MMR, for measles, mumps, rubella, and polio. In 2021, those numbers had dropped to 79%.
Oh, wow. How does that compare with other states or
So it's you really have to go through and look at every individual vaccination, but overall, we rank about 36th, which is better than you might expect.
Yeah. I'm used to us being 48th and 49th,
Right,
so I guess 36 is not terrible. As a result, are we seeing more cases of vaccine preventable diseases?
Well, yeah, I mean, pockets we've seen. I mean, we haven't seen a lot in Texas, although there's been a little measles. Dr. Peter Hotez told me a few weeks ago he said measles always pops in the spring if you're going to have an epidemic. So he said, so over the next 2 months is what we ought to watch for to see if that happens.
All right, so our folks always want to know, this might be a two-part question for you, but what can listeners, what can local congregations do to help encourage vaccinations in their local communities? And then we'll talk about the legislative components next.
Yeah, I mean, I think I really believe, and all the research I've seen, polling, messaging research says that people have people they trust.
Yeah,
people trust their pastors. If pastors would encourage it, if they would say how important this is, because the other thing to think about, and I think particularly in our churches and our houses of worship, what we can think about. One of the things that COVID has done is it's made us so multi-generational in our living. Many families are now having multiple generations under the same roof. So that danger of your child getting measles and bringing it home to their grandparent is real.
Yeah.
And I think a pastor can make that argument in ways I can't.
Yeah.
But I think, it's talk to your neighbors, talk to your fellow congregants. If you have any doubt, and you said, as I would agree, that we all just sort of blindly went in, rolled up our sleeve, took the shot and left. But, ask your doctor to talk. I say, I want to talk about this. I don't know if I want to get my kid a shot. Talk to me about why I should. Listen to your doctor and urge your neighbors and friends to do the same thing.
Yeah, is that part of the messaging that you would encourage clergy and faith leaders to have? Is get your shots, but also don't listen to cable news. Go talk to your doctor about this.
Talk to somebody. Yeah, I don't advocate for blind faith on this. I mean, I have a lot of faith in vaccines, but I don't think it's blind faith.
Yeah. Yeah.
And so I think people need to be encouraged to speak to the scientists and doctors they trust. And again, I think, and every community has people that we look up to. I mean, it may be your pastor, it may be, it might be your school principal or your school nurse.
Yeah. Right. So I guess the second part of that question, so we want to do the work and making sure that people are getting information about vaccines and getting their shots. But we are in the middle of a legislative session, and this is a podcast focused on encouraging people to have conversations with their legislators. What would your messaging be to when folks are making those legislative calls, when they're visiting with their representatives?
Yeah, I think that they need to talk about a few things. Vaccinations have saved millions of lives and billions of dollars and trillions in societal cost in their 100-year history. We have had vaccines for 100 years. The polio vaccine was first administered in a mass inoculation 69 years ago this month.
Wow.
And in 1990, polio was declared eradicated from this earth. I think it's important to talk about that there are probably 2 adult generations, many of whom are these folks in the legislature, who've never seen any of these diseases.
Right.
So I think if we haven't put it on our website yet, we're posting on our website a chart that I've discovered is really powerful with everybody I've talked to. It doesn't talk about the vaccine. It just says, here's the disease, here's the consequences. And, polio, the consequence is a lifetime of physical disability and breathing problems, et cetera. And, meningitis, deafness, and measles, death, and brain injury. And I have found that when we show that to people, it's very powerful.
Yeah.
And so, like I say, if it's not on our website right now, it will be in the next couple of days. So I think that's a tool that people can use when they visit their legislators. Say, look, this is why I think it's important to be vaccinated. Love it. And then and I think it's the final point I would make is these folks. A lot of these anti-folks say, well, I want to have a choice. I want my kids to have a choice. You have a choice. You do have a choice in this state, a big choice. As an adult, you can take it or leave it. On behalf of your children, you can get exemptions for them if you so wish. I wish you wouldn't, but so talking about vaccine choice is a red herring. And we need to call it out and we need to point it out to these legislators because I think some of them just simply don't know. I mean,
All right. Terri Burke, appreciate the time. Let's all get our shots. Any shameless plugs you want to leave us with today?
The Immunization Partnership is having this annual fundraiser luncheon on April the 20th. And we're having Marie Brenner, who wrote a book called The Desperate Hours about what happened at Presbyterian Hospital in New York in the first 18 months of the pandemic. Oh, wow. It's a riveting story. It reads like a novel. That's in Houston. So if you're in Houston, go to our website and look up that. We're honoring several heroes, Peter Hotez and Maria Elena Battazzi and Mark Boone, the CEO of Methodist Hospital, who fired 150 people for not being vaccinated. And otherwise, my shameless plug is please, please, please talk to your legislator. It couldn't be more important.
Absolutely. That is a good message to end us with. Terri, thank you so much for the time, and we'll talk soon.
Thank you. Bye-bye.
I'd like to thank Terri for joining us, but I especially want to thank you for tuning in. I hope you are updated on your vaccinations and take some time to invite your friends and loved ones to do the same. I know this has been an area of focus in the COVID area, but make sure that you're getting all the shots and take some time to let your legislators know that you support vaccines. I personally thought we were past this, like we were past polio, but here we are. As we wrap up, make sure that you're subscribed to the podcast and are sharing it with your friends and congregations, and go to texasimpact.org for other ways that you can get involved during the legislative session and beyond. While you're there, make sure that you and your congregation sign up to be members of Texas Impact to support this podcast and the work of Texas Impact year-round. We look forward to resourcing your advocacy, and I'm happy to try my best to answer your questions, so feel free to reach out at scott@texasimpact.org. And with that, I think it's time to close out this episode, so remember, the world needs Texans of faith active and engaged. So let's get to work.
Weekly Witness is hosted by Scott Atnick, engineered and produced by David Fasalo. Our executive producer is B. Moorhead. The opinions expressed on Weekly Witness are those of Texas Impact and our guests, and do not necessarily reflect the views of our sponsors. Weekly Witness is a product of Texas Impact, people of faith working for justice. Visit us online at texasimpact.org.